So I'm going to start with a question for Doreen, if that's okay. Having said that, a lot of these questions are can be relevant to all the presenters. So I mean, please feel free to jump in after I've asked you, Doreen. So a question from Alan Davis here, when he's talking about, in your presentation, Doreen, you talked about research being jointly owned. So Alan was asking, what does that mean in reality? How can research be jointly owned? Where does power lie in that process? How can the realities of power in these relationships work themselves out in jointly owned research? It's a tough question, so I wonder if you could have a go at answering that, and then we'll open it up to what other people say as well.
Okay, thanks, Richard, and thanks, Alan. I think that the co-production guidelines outline what would be the ideal. So I think just following on from Gary and Katie's presentation that showed what we would like to happen versus the fact that there are challenges to implementing the guidelines and the values and the principles and the standards that the NIHR would like to further. So power sharing and joint ownership is the ideal that we would like to move towards, but we do have to acknowledge that on the ground, this can be very difficult to implement, especially as most funders actually will have a principal investigator or a number of principal investigators in the sense of global health being an equitable partnership between the global north and south. So in our discussions, and Katie and Gary, feel free to chip in, because we worked in conjunction on the co-production guidelines. They were actually led by Gary Hickey. I think the discussion we had around this was the fact that you can co-produce and still have a person actually leading the project by ensuring that you have a very honest discussion at the beginning about who would be involved in which parts of the process. So for example, if you have a statistician, they might not necessarily be involved in all of the project, but they will have ownership and you know that they're leading on that part. And if you have that honest conversation at the beginning of the process so that everybody has a joint understanding of how the research is going to take place, and they're actually involved in all aspects and points where decision making is being carried out, then you can co-produce the research. But there isn't a getting away from the fact that the research structure is actually further there being a lead. And I think just referring to Nabil's presentation, sometimes where this isn't done very well, some partners of the research process then are left out of that decision-making process. So what we would like to ensure as the NIHR is that the decisions are made jointly, but you will have different people taking ownership and leadership of different parts of the research project. So just to acknowledge that we are aware there's many issues around furthering co-production. There's an interesting journal article series published by Frontiers that explores that in quite a lot of detail, looking at different elements of research and then looking at how far you can co-produce and what are the opportunities and challenges within that sphere.
Anyone else from the panel like to offer? Gary, go ahead.
Yeah, I mean, I would actually back everything that Doreen said there, and I suppose another way of looking at it, it could be that the people around the table, the team, jointly decide who is involved in what, as opposed in the past, it's usually, isn't it, it's the researcher, the professional who determines who is going to be involved in what part of the process and has the final say, etc. But I think in a co-production exercise is you jointly decide, and that's the sharing of power. And as Doreen said, it's not that everybody is involved in every decision, but it's about you jointly decide who's going to be involved in what.
Okay, thank you. I think that issue of power is we're going to keep coming back to that as we go through the questions. It seems to be perhaps the most commonly asked, referred to question that people have submitted. So Doreen, if you don't mind again, picking up another one. This is from Pafati Panay. How it's a very broad question. How do we meaningfully engage with those hard to reach populations? That's a question that people have asked other presenters as well. But you know, we talked about the importance of reaching out and engaging with those communities, seldom heard communities. How can we do that in a meaningful way? That's a very broad question, I know.
Didn't realize I was muted. A very broad question. I think everybody could probably contribute towards that. We've gone away from calling them hard to reach because I think that's the perspective of kind of the research community, saying if they're hard to reach, we can't get to them, when in actual fact, they're actually there. So we've moved on to one of the terms that's used is seldom heard, but again, I think there are issues with that term as well, because they could be heard, but we're not actually reaching the people. So I think the onus really is for people who might hold the research power, you know, the funders and the researchers, to actually go into the communities and engage with people. Often you might have to do that through an intermediary or somebody that is respected in the community, or somebody that might act as a gatekeeper to the community. I think there's also issues about how we communicate. Nabil spoke about this, about how we translate our outputs, how we engage with people, the language that we use, the formats of the you know, the language and the format in terms of you know, paper work, the internet. Those might not be the best ways to actually engage and involve people that might come from groups that we haven't engaged with in the past. So they are methods that we can use, but we definitely need to go to the people, understand the power structures in the communities, understand how the communities are organized, and work with people within the community to then reach the rest of the population in a way that's actually acceptable to them. But I think this is probably one that everybody can comment on. So I'll stop there.
Anastasia and Nabil, you know, from your, in terms of your presentations, you know, about innovation and using the arts and so on, are these useful ways of engaging with seldom heard communities?
Yeah, so I guess we're speaking about very different means of engaging and how to go about. So I've been working in research contexts as well as engagement contexts, and I have to admit that a lot of my work being an independent has been on a smaller scale, and I've tended to work with existing structures within the communities. As problematic as the word community is, I've worked a lot in our context with faith-based and then art societies as well. And I've always strived to work with a mobile office, meaning working directly from my car in a very visible and transparent means, so that I am as accessible to people as I choose to be to them. And often working in a very transparent way, including funds available, including methodology, including being fluid about process, that I choose to work within processes that are relevant, sensitive to these spaces, and to develop mechanisms for communication between and across. So yes, it takes more time. A lot of my time is invested in relationship building. But I found that once I've opened up my table, so to speak, people generally have worked in direct collaboration with me. It's a tough question, and I can imagine it's a really hard question when you're working with larger data sets and much bigger spaces. But yes, I've also been very open with how I use data. So often presenting it first and foremost to the people I've been working with, if it's reflective of what is wanted, so as not to present a portrait of people versus their actual lived realities.
Thanks, Nabil. Anastasia, did you want to say something there?
Yeah, just to echo what Nabil said, and maybe also to bring in another perspective, something that we've sort of hypothesized, and going forward, I'd really love to start trying to generate some actual evidence for this, is that what often works, for us at least, is to intensively engage with smaller groups of individuals from seldom herd communities, because the engagement tends to be allowed to be a lot more intensive, and then that seems to be a higher quality of engagement than trying to use approaches that are sort of more generic and target larger numbers of people. And so we've been very lucky that our funders have not always been too concerned with large numbers, and so we haven't had to worry with targeting very large numbers. So our engagements can be very high quality and very tailored to almost the individual level, which is very difficult to do and quite intensive. And we've had to now start building in structures into how to keep the quality of the engagement but increase the numbers. And so I think that can also be very valuable when trying to build trust with different groups of people. And so just to throw that in there and to echo what Nabil was saying.
Thanks. I'm just looking at this issue from a slightly different perspective in terms of geography, and there's a question here we've had from a participant asking about how do you reach out and engage those communities that are perhaps rural or dispersed. You know, we often talk about involvement and engagement in terms of class, social class, gender, ethnicity, and so on. But what about that issue about rural communities, dispersed communities? Because that's often a feature of working in the global south, isn't it? Yeah. Any thoughts about that, Anastasia? Perhaps.
So that's a really excellent question, and probably one that I'm not fully qualified to answer, because we've not actually done any intensive engagements in any very rural areas in South Africa. But it's an excellent question, because we do have quite a broad variety of urban and rural areas, and I think the mode and process of engagement would be very different. And even in terms of, we've been doing a bit of research in terms of media uptake. So what kind of media is used in urban and versus rural areas, and that can make quite a huge difference as well. So we've got, I mean, COVID came in and I guess put everything on hold, but we've got some co-implementation projects planned. The one thing that we did do was go and work in another African country that isn't South Africa. And so we recently did a project in Gaborone, which is even just two countries next door to each other, are completely different contexts in terms of how people frame infectious diseases, how people interact with biomedical research, how the biomedical research, I guess, politics are set up in different countries. And so that was a huge learning curve for us in terms of how to very rapidly adapt a model that we applied in Cape Town, South Africa, to somewhere like Gaborone. And so I really agree that our models and ways of engaging have to be really, really quickly responsive to the specific area and setting that we're trying to engage. And maybe just bounce this off to Nabil, because I think he has done a little bit more work in rural parts of South Africa, so maybe he has some stuff to add.
Yes, so one particular project comes to mind. We work in peri-urban areas all over South Africa. I've worked in one area that had no internet connectivity. This is in rural KZN in the North Province. And it was really tough because, for one, I was working as an independent in collaboration with a large institution. So my physical time in these spaces was dictated by the institution, which meant I couldn't be as effective or efficient or as available as I chose to be. Second to that, working in collab or being contracted by institutions also means that I couldn't work with my own team. So we had a language problem, which was very visible. Running a participatory process, let's say designed for 10 days without my team, meant that I needed about 1 month because of lingual issues. And so it brings another dynamic, not having your team, not having the time, having a lot of sort of protocol dictated upon you. And then also living in South Africa, having limited tech available and connectivity. So I can't directly answer the question because I could not take the traditional approach, which I normally do, which is spending roughly 2-3 months in that space, making relationships, finding ways to really present what projects and research is about before continuing. So yeah, it's a really tough one because I think I don't have enough experience in rural, but more in peri-urban.
Thanks. It's a tough question. Thank you. I'm really conscious of the time. We've only got 5 more minutes. We'll try and get a couple more questions in before we wind this up. So we had lots of questions come in about the concept, the idea of user-led research. Is it desirable? You know, that continuum that Gary talked about. Is it desirable that we move along that continuum to the right, to co-production and user-led research? How important is that? How realistic is it? To be honest, it involves giving up a lot of power and so on. So what are people's thoughts about that? Perhaps I could ask Gary and Katie first of all.
Do you want to take that, Katie, or do you want me to begin?
I'll say a few things. I've got mixed feelings about this, actually. As a survivor researcher myself, I'm trying to get funding for survivor-led research projects. Is even with support from your host institution is still a real challenge. So on the one hand, I'm really in favour of making those opportunities happen and supporting and funding that stream of user-led, survivor-led research, which we don't have enough of in this country, and we need to have an awful lot more of. By the same token, I also think there is value in collaborative, co-produced research. You know, we learn a lot from working with each other, and I would hate to see that disappear in favour of just purely user-led research. So I think it's about prioritising more spaces for user-led research while still supporting the more collaborative spaces that we have. I think there's value in all, but yeah, we definitely need to foreground many more opportunities for user-led research.
Thanks, Katie. Very quickly, Gary. I'm sorry, we're really out of time.
I mainly echo what Katie said. And my personal view is that one approach isn't necessarily better than another approach. It really is horses for courses, as we say, you know, whatever works. And I think what we want to get to a situation where we have a mix of approaches that are equally valued. And as Katie said, therefore, we need to create that space so things like co-production and service user-led research can flourish alongside collaborative and consultation approaches.
Thank you. One last question, which has cropped up several times, which is about how do we change the culture in organisations to bring about the change that all people seem to want to happen. You know, if there was one thing that you could ask of organisations, or what would those be? You know, how can we bring about that change? Anyone like to have a stab at that one? Doreen, and then Katie. Doreen.
I'll be very quick just to allow Katie to come in as well. I think that you do need a carrot and stick approach. Some work that we're carrying out at the moment shows that I think, first of all, if funders make this a criteria, as Gary had said, that brings a top-down requirement. There's a danger of tokenism within that because people do it because they have to. But we have noticed that in the UK, this has moved the direction really into organizations and institutions actually then having patient and public involvement embedded within their structures. But I think that we could go more. The reward structures, for example, and publishing could also reinforce this, where they don't just value academic outputs, for example, but we actually then also value co-produced outputs. And also the assessment for promotions, for funding for institutions could be more closely tied to patient and public involvement or community engagement and involvement as well. So I think that there are institutional things that we can utilize and harness to actually change the culture. But I think ultimately you also have to work with people as individuals, and there's a lot that can be done around training. but also collecting impact measures to actually show researchers that this is a good thing to do and it benefits their research. Because if they do it just because they have to, it won't actually change the culture.
Thank you. And Katie, very quickly, I'm sorry, our time's really...
Yeah,
really...
just one sentence. Create the opportunities so that people with lived experience can be in positions of responsibility and power and influence.